As a patient, you're reserved a number of rights to ensure that you have a positive and active relationship with your health and with the healthcare system helping to facilitate it. Several of these rights may be guaranteed by the federal government, while others may be determined at a regional or even facility level. This means your specific rights can vary depending on where you live and which healthcare facility you attend. In this module, we'll be going over how to find what these specific rights are, as well as the resources at your disposal to ensure that the rights are properly being met. Note that while we draw examples mainly from the United States, comparable approaches can be applied to other countries. Your federal government may choose to enact healthcare rights that are applied to all medical centers nationwide. We focus on one example from the United States. In 2010, the passing of the Affordable Care Act under the Obama administration set up a Bill of Rights that provides patients throughout the United States with protections in regard to medical insurance and medical financing. Notable protections include the following. If your plan covers children, you can now add or keep your children on your health insurance policy until they turn 26 years old, even if they are married, not living with their parents, attending school, not financially dependent on their parents, or eligible to enroll in their employer's plan. Also, health insurers can no longer charge more or deny coverage to you or your child because of a pre-existing health condition like asthma, diabetes, or cancer, and they cannot limit benefits for that condition either. Once you have insurance, they can't refuse to cover treatment for your pre-existing condition. For a full list of policies and exceptions, the U.S. Department of Health and Human Services has the information posted on their website, hhs.gov. Individuals from outside the United States may find their programs detailed on the website of their country's governmental health division or a local reputable healthcare organization. Aside from national legislation, you also have rights at a local level, for instance, at your local hospital. In today's online era, these rights can generally now be found through the official website of your desired healthcare facility. The website will often have these rights listed under a section with a title synonymous with patient rights or patient bill of rights. For example, this center in Los Angeles has a webpage titled Patient Rights, entirely dedicated to documenting all of the rights guaranteed to patients at their hospital. As you can see, one right this particular center grants patients is the right to request or refuse medical treatment to the extent permitted by law. This policy in particular is one upheld by most, if not all, healthcare centers in the United States, and is one of many to look for. Sometimes, however, a facility's website may not have a section dedicated to patient rights, or the section may be hard to find. In these instances, contact the facility via phone call to ask about the ways you can access this information. This number can usually be found at the bottom of the website or in a section titled Contact Us. If your local healthcare facility does not have a website, you can usually find their phone number through a web search of the facility's name. Once you're made aware of your rights, it is now possible to tell when a right is being violated. In other words, when an action taken by a healthcare facility goes against or disregards what is listed as a patient right. Let's have a look at a real-life case study where patient rights were found to have been violated. 2016, a group of cardiologists fell into trouble when it was revealed that they had a publicly accessible online calendar containing surgical and clinical appointments. The calendar was found to be in violation of the American Health Insurance Portability and Accountability Act of 1996, known popularly as HIPAA, which outlines a set of standards in place to keep a patient's health-related information confidential and secure. Since the calendar revealed sensitive healthcare information without the permission of the patients involved, the physicians were forced to pay a $100,000 HIPAA settlement. If you still have questions regarding your rights and/or believe that your rights may have been violated, you may contact the hospital's ombudsman, individuals recruited by a facility who act as a liaison between patients and the facility. Ombudsmen oversee patient concerns and work to ensure that a patient's needs are properly addressed and taken care of. Many are also able to deal with issues related to billing and payment. There has also been a recent shift towards private patient advocates, individuals who are separate from the medical facility, and help patients navigate their health both inside and outside the hospital. Like an ombudsman, patient advocates can help you maneuver through the healthcare system and understand your rights. Patient advocates differ from ombudsmen primarily due to the fact that they are not hired by a healthcare facility and thus do not have a strong incentive to cater to the facility. Additionally, many patient advocates can provide a broader range of knowledge to their clients, as they are not limited by the scope of services and amenities offered at a particular facility. For instance, an advocate could help a client schedule appointments across different healthcare centers to see what location would best fit the client's situation. Note that healthcare facilities themselves may also recruit patient advocates, although, like ombudsmen, their scope is generally limited to that of the facility, and they also must keep the facility's interests in mind. At an organizational scale, there are nonprofits, both local and national, that exist to help inform patients on healthcare literacy and communication. These organizations may have helpful resources catered to your specific need or area. And like private patient advocates, many nonprofit organizations do not have incentive to cater to a specific healthcare facility, and thus can provide a fair and unbiased assessment of your situation. However, remember to practice caution when gauging the reliability of an organization. Ask yourself questions like, does the organization seem professional? Do they have a good reputation? Are they simply trying to advertise and sell a product or service? Consider these types of questions when engaging with a nonprofit to ensure that you are receiving the appropriate assistance. We hope that you were able to see the many different ways you can find information about your rights as a patient. As you traverse the healthcare system, have confidence in knowing that there are measures in place to ensure that you have control over your own health.